I'm Dr. Sonal Anand. I'm a consultant psychiatrist at Wockhardt Hospital, Mumbai and Bethany Hospital, Thane. Today I'm going to speak about depression and suicide. So first we must know that everyone goes through phases of feeling sadness and feeling low. So just normal feeling of sadness cannot be described as depression. Depression happens when it starts affecting the way you think and the way you act, and when you feel that your day-to-day activity is also affected by your negative thinking. There are a lot of risk factors involved for depression. If you have a family member who's had depression in the past, then it makes you more likely to suffer from depression, especially if you have a parent. Now some people who have gone through some hardships in childhood, or who are currently also going through strenuous relationships, they are also more prone for depression. Sometimes physical condition, a physical illness, and even some medications also can cause depression. There are many treatment options available now for depression. It's not like how it was in the earlier days where just one or two medications were available, and even ECT was considered for severe depression. We have newer modulated treatments which do not cause a lot of drowsiness. Medical management is not the only option for depression. Sometimes if the depression is mild to moderate, or if the situation is causing depression, then counseling has a big role to play in that. Therapies like CBT, cognitive behavior therapy, REBT, these are known to help improve the person's mood and to change thoughts so that the person's negative thoughts are replaced with more positive thoughts, and they know how to handle the situation better. But in cases where depression is quite severe, medical management does become the primary focus. Now, if you think that you are going through depression, there are certain things that you can do to help yourself. First and foremost, you should know about the signs and symptoms of depression. If you feel that you're feeling gloomy and sad most of the times, or you feel lack of enthusiasm in your daily work, you feel that you can't enjoy the activities that you used to enjoy before, you feel that your appetite is lost, or you're eating too much, either thing can happen. If you put on weight or you're losing weight, if you are having sleeping problems, and if you feel a sense of worthlessness or hopelessness, and if you're having thoughts of self-harm, that is the time when you know that it's going towards a point where you need to meet a mental health professional. Meeting a mental health professional should not be scary at all. In the end, it is a disorder. It needs to be treated by a doctor. And we know now that a lot of neurotransmitters are the reason why we are going through depression. So we as mental health professionals know how to treat depression. So if you feel that you are suffering from depression, it is essential to talk to a mental health professional. If you know someone who's going through depression, I think the best way to go about it is to encourage the person to speak up, to talk about his or her emotions, to communicate freely, and to make sure that the person visits a mental health professional. If the person is already taking medication, it's important that the person continue with the medication and visit the doctor frequently. Keep yourself posted for that person, and make sure you are aware of how the person is, and keep asking about how the person is feeling. And be aware of when the person talks about suicide and many negative thoughts.